The other thing to point out there is we don't have any incentive to place stop loss anywhere, but we always ask our broker partners, one, we'll shop it for them if they want us to, but two, if they want to shop it themselves, we want to be involved in talking to the underwriter that's working on the case so that they know exactly how our claims management model works. Because there's sort of a less talked about component of our program that I think makes a huge impact, and that is the audit. We have a clinical team on our staff, a team of 10 people who audit every single facility claim that flows through all of our plans before we even go to reprice it. So you mentioned repricing it to 140% of Medicare or whatever the number is, but we're taking all of the I've been saying fraud, waste, and abuse since long before it became politically popular, but we're pulling all the fraud, waste, and abuse out of the facility claim before we even start to reprice it. Because you have to consider that these hospitals have departments set up to maximize their revenue. They have revenue cycle management departments, and they have multi-million-dollar software systems that are designed to get the most out of every single patient that comes through their door. And they know that the PPO networks and the HMO networks are just auto adjudicating those claims. And so, we're seeing multi-million-dollar claims that are getting auto adjudicated all the time. And so, when the underwriters understand the type of controls we're putting around large facility claims, we're typically getting bigger discounts than even other reference-based pricing vendors, because it's one thing to price a claim to Medicare plus a markup. It's a whole nother thing to pull all the unbundling of charges that should have been bundled under one price on an ICU charge and then repricing what's left to Medicare. Those are two very different numbers. And so that's an important distinction I want to make.
Yeah, I appreciate you bringing that up, Omar, because obviously a claim that was billed incorrectly from the start, it doesn't matter what the Medicare Plus rate is. It shouldn't have ever been billed at that rate. And so obviously you want to be billing it off of what should have been billed correctly the first time, not incorrectly. The other thing I wanted to ask you about, and this is a question that I get a lot from HR directors, is what is the member experience when you switch from a traditional PPO network and move to a reference-based price type model with ClaimDoc? What does that look like? Do they still have an ID card? What does it say on it? What if the provider turns them away or says, we don't take your insurance? How does ClaimDoc handle all of that?
Yeah, you just asked about 6 different questions in that one question, and so I could go on for about an hour on that.
If you couldn't tell.
So yeah, that was a loaded question. So I'll start with how we go about the transition. So first things first is we're going to assign a dedicated implementation person to the account that is going to help manage the communication and education that goes out to the entire population. So we sort of become the conduit between the HR at the client level and the consultant and the TPA and ClaimDoc. And so we have some very good implementation managers who their main job is to make sure that when we set up a new group, the proper education pieces get in front of the group, the communication pieces are done right. We have a marketing team on staff that's going to brand everything to the client. So anything that goes out to the members looks like corporate communication, because you really have to understand what you're getting with our style of program. You can't just sell it based on a lower rate and expect people to understand. The one thing that we ask members to do is engage with us before the effective date, and that's part of the Pave the Way program. We want to know who they are. We want to know if they have appointments coming up right after the effective date, because we want to be able to do that proactive outreach to the physicians effectively. And that sort of, it does a couple things for us. It makes the transition from PPO to RBP smoother, but then it also gets the members familiar with who we are and our member advocacy team and comfortable with the process when they know that they've got a human being that's going to answer the phone that they can lean on for support. So that's sort of the start of how we make this go well.
And then when the employee is ready to go and the plan is live and they're going to use their plan, and they go to a doctor's office and the doctor's office has never heard of ClaimDoc before, what does that look like?
Yeah, so if they haven't done the Pave the Way program, where we're essentially contracting with the doctor. If they haven't done that, then they're going to walk into the doctor's office. They will have an ID card. The ID card will have the TPA information on it so that providers know to reach out to the TPA to verify benefits and eligibility. And then there's also the ClaimDoc logo and the ClaimDoc member advocacy number on the back of the card as well. That says, for plan members, call ClaimDoc. And so most of the time when somebody goes into a doctor, the patient intake coordinator at the front desk is going to call the TPA and they're going to verify, hey, is Gentry Harris eligible for benefits? Yes. How much money do I need to collect from Gentry Harris today for a doctor's office visit? Whether it's $25 or whether it's a deductible expense, whatever the case. If that's what happens, then great. You're going to be seen and it's going to be, you're going to get the care that you're expecting to get. You're going to go home and that's that. In a less common scenario, if the patient intake person says, well, we don't know who the TPA is, or we don't know who ClaimDoc is, and this is going to be treated as, an out-of-network price, or we need the cash rate up front. If they tell the TPA that, we're connected with all of our TPA partners. And we're trained, like we know the TPA system, we have access to their claims portal. The TPA customer service team knows how to transfer calls to ClaimDoc. We're going to get that call from the TPA with the provider on the line so that we can work out a payment arrangement like at point of sale. We do that for office visits. We do it for planned procedures that are going through the prior authorization process. But we have a provider relations team on staff that's dedicated just for that. So that's typically how that would work.
Yeah, no, I appreciate you explaining that. I think one of the big concerns and something that some other brokers may do to scare individuals is tell them, oh, you're going to have all these people that aren't going to be able to get care when they need to get the care. And that's simply not the case. And the other scare tactic that I've heard is that those people are going to be sent to collections and it's going to damage their credit. Could you speak a little bit to some of those points? Again, I know I gave you 3 or 4, but how do you combat, that scare tactic that, some brokers are using to say, oh, you got to stay in this PPO network and it's a warm, cozy blanket for you to, curl up on and put over yourself?
Well, number one, they're saying that because that's where their commissions and their book overrides come from. So, and it's easy, right? It's the easy button. Mm-hmm. So I get why certain consultants, if they want to call themselves that, are saying those types of things. But in a worst case scenario in our model, someone goes into the doctor and doc says, hey, we don't know what this is. We got to charge you the cash rate. Usually those discounted cash rates are pretty good anyways. And so in a worst case scenario, the member's got to pay the cash rate. ClaimDoc with our advocacy team will hold their hand and walk them through the reimbursement process. So even if you have to fork over the full amount of a doctor's office visit on your credit card, ClaimDoc's going to assist you to get a what do they call them? Basically, you get a claim submitted to the TPA, and the plan would pay you back directly, less whatever copay you're supposed to pay. That's a worst case scenario. When it comes to collections, I haven't heard about a collection problem in quite some time. Our balance bill rates across our book of business are coming down. We're now at 1.5% of all medical claims are getting a balance bill, which is way down. Some of that has to do with the No Surprises Act. So that's the No Surprises Act has kind of helped us all out in this little niche of our little vertical that we're in. And so, 1.5% of our claims are getting a balance bill, and a fraction of those could potentially go into collections. So we hear about the scare tactic of the hospital could sue your employees, or you could get your credit impaired, or there could be collection notices. And there is a chance for all of those scenarios to happen. What we do about it is we write ourselves into the plan document as a co-fiduciary to the plan sponsor. So per federal law, we must act in the plan's best interest, just like a 401k provider. And the other thing we do is we provide amended plan language that states we would protect the plan and plan members from any sort of predatory billing practices. So that means a balance bill, collection notice, credit impairment, lawsuit. It is ClaimDoc's responsibility and ClaimDoc's legal expense to make those problems go away. So that's part of the story. Going back to the member, when a balance bill does pop up, we get notice of the balance bill, and the member advocate goes back to the plan member and says, "Hey, Gentry, we understand you can't afford this $5, $10, $20,000 bill, but don't worry about it, because never in our company's 12-year history has a member had to pay more than their deductible or out-of-pocket maximum. And oh, by the way, don't forget, your plan comes fully loaded with ClaimDoc legal services. So you have a lawyer working on retainer for you. You don't have to pay for the lawyer. Your employer doesn't have to pay for the lawyer. It's just something that's part of our program, and it's our obligation to make this problem go away on your behalf. So your only responsibility is to let us know if you get a phone call, or let us know if you get something else in the mail. Don't pay anything. Just let us know so we can handle it."
Yeah, and balance bills occur obviously with a standard PPO network as well,
Right.
and you don't get any type of support for any of that. That's on
Right.
you.
So, right.
Figuring it out.
So do you want the legal services that I just mentioned, or do you want to call Blue Cross customer service and deal with them yourself? You know, it's kind of like,
Yeah.
what are we talking about here?
Yeah. So when somebody does get a balance bill, they send all that information to ClaimDoc, and you guys handle it from there, including any legal representation, walking them through phone calls, emails, mail that they receive in the mail. They just turn that all over to you for you guys to manage it, and that's all the member has to do.
Yeah, and they can deal with the same member advocate throughout the entire process. So they're not having to call into a call queue every time. Our member advocates are trained to give away their direct phone line and their direct email address. So once you submit that balance bill to, Levi, you can deal with Levi the whole time until we get a resolution. It's not like you're having to deal with different people who don't know your scenario.
Yeah, it's really a wonderful model in terms of customer service and just keeping consistency with the same individual. So
Yep.
we've seen it on several of our groups that we work with, and shifted from one, reference-based pricing vendor to another and seen a dramatic difference. So it's obviously working and takes a lot of the frustration out of the plan.
Yep.
Just to wrap up, Omar, again, I appreciate your time today. If you could pick one thing where you feel like when it comes to claims and networks, if you could pick one thing that's the biggest ripoff that you see from a member perspective, what would it be?
It would easily be the egregious billing of inpatient hospital stays. Easily.
And do you have any examples of seeing that happen?
I have daily examples. Yeah. I mean, we post a bunch of them on our website. We put them on LinkedIn. Our lead auditor, a lady named Cynthia Swanson, she's, I'm careful to use the term expert, because who's really an expert anymore? But Cynthia Swanson is a real expert. She gets called into court cases that have nothing to do with ClaimDoc, just as an expert witness on disputed claims.
Wow.
So, but she's the one who typically puts those examples out. But we see them literally daily. We see multi-million-dollar claims that should be billed, far less than that and paid way less than that. So, I think those large ICU claims are a big problem.
Yeah. Well, again, I appreciate you making the time, Omar, and kind of walking us through some of the different things that ClaimDoc does, and appreciate the partnership that we have with the clients that we work with, and look forward to helping other employers and employees all across the country help save money by reducing their overall claim spend and not paying a claim that was, inflated to benefit the hospital as well as the insurance companies, but to actually work for the employer and the employees. So appreciate your time, and great to have the conversation with you today.
Thanks, Gentry. Have a good day.
Thank you. You too. Goodbye.